Here we are. Good morning. Welcome to KPCCI Planning Orientation, Assessing Capacity and Community Checkbox Training. And I'd like to introduce Stephanie Reinhardt now. Stephanie is an incredible leader and a visionary leader for prevention and promotion at KDADS. And I'm really excited to be able to introduce her and turn things over to Stephanie.
Thank you, Chad. Good morning. If you all have not met me before or spoken with me, as Chad said, my name is Stephanie Reinhardt, and I'm the Prevention Program Manager at KDADS. So we oversee the KPC team and also the KPCCI program. So as Chad said earlier, welcome. It's so great to have all of you here today for the orientation that kicks off the beginning of our fiscal year. I ask that as you go along, if you want to utilize the chat for questions, that's fine. But also, if you just want to focus, we're going to give you a lot of information today. Jot down your questions and we will have time at the end to answer them. But again, thank you so much for taking time out of your schedule to spend with us in this first day of orientation. Next slide. So as I said, we have a packed agenda, and these are the items that we will be going over today. And so sit back and relax and soak in as much as you can. As we go along, my team will introduce themselves. And so at this time, I'm going to pass it off to Alexis.
Next slide. Good morning, everyone. I'm Alexis, one of the prevention consultants at KDADS, and I'm happy to introduce the planning grantees for the upcoming fiscal year. So we have Quality of Life, ASPEC of Republic County, Woodson County Coalition, Barber County United, Miami County Mental Health Initiative, and Tri-Agency Intervention on behalf of Haskell County. Next slide. So the chart on this slide shows the structure of the KPC and the support provided by each KPC partner. KDADS provides grant management and financial compliance support. DECA provides coalition training and technical assistance. And then the Learning Tree of Greenbush and KU Center for Community Health and Development support data collection, analysis, and evaluation. And then Wichita State University Community Engagement Institute supports communication and connection initiatives. And more will be discussed about each partner on the upcoming slides. Next slide.
This one's mine. I'm Kitty. I'm also a prevention consultant with KDADS. So one of the partners that Alexis mentioned was DECA. DECA is a contractor with us with the KPCCI coalitions, but they also work with other prevention coalitions across the state. One of the great things about DECA that you'll see is that they do keep a staff member in each area of Kansas. So you will have someone, if you haven't met them already, I'm sure you will right away, that it'll be a closer link, and they'll be the person that works with your coalition. Okay, next slide. Another of the partners that we have, is this is for the evaluation. We provide this from the KDADS perspective because we also have to evaluate and report back to the state block grant. And so KU, Community Health and Development, and also Learning Tree, they're collecting data. They're helping you to determine what's important and why it's important, and teaching you as they go so that you'll be ready for other grants in the future. And I think it's back to Stephanie.
Next slide. Thank you. And then the last KPC partner that we want to introduce you to is Wichita State University Community Engagement Institute. You may also hear CEI. And one of the important things to know about our contractor, Wichita State University, is they are also responsible for updating our website. If you have not visited our website, please take an opportunity to do that. There you will find not only a map with all of our coalitions, but also resources and also upcoming events through our program. So next we will go to the next slide. So we're going to start off talking a little bit about the grantee, which is yourself, overarching scope of work. If you have not already received, you will be receiving your contract, and you will see at the bottom of your contract your scope of work. Basically, that is what we are asking you to do during your time with us through the KPCCI planning process, or if you're in another stage of the KPCCI program. Moving back on to Kitty.
And this one is ta-da, because if you haven't seen the strategic prevention framework yet, you're going to see it many, many, many times, even today. Later, they'll go into this more in depth. But what I wanted to say here is that we also use this at KDADS. We use it across a lot of programs because it is the tool that's recognized as being the best. Another thing that I like about this slide is over on the right side, the engagement of the 12 key community sectors. And it's meaningful to me because the first coalition meeting that I went to many years ago, I was invited and didn't know why. And this was posted on the wall when I walked in. And I think this tells people that want to be involved with your coalition why we're all here. And I could see immediately why I'd been invited because I was representing a sector in the SPF. So next slide.
Throughout this grant, there are certain grant deliverables that will be asked of you. This includes submitting monthly physical reports. More will be discussed on these deliverables in later slides. And you'll be also asked to complete documentation in the community checkbox, monthly progress reports, quick checks, logic models, and KPC action plans. Next slide.
So, when we're talking about some of the deliverables and some of the scopes of work that you will be responsible for at a later time, KU will speak to you about the community checkbox, which is our data collection system for all of the strategies and activities that you'll be implementing, and the Kansas Communities That Care survey, which is the state survey that we use in Kansas for our youth, and also have a young adult survey for young adults. So the main thing to take away from this slide is documentation is key. As Kitty mentioned, we are fully funded by federal funds. We do not receive any state funds for our KPCCI program. So we have to report on a regular basis to SAMHSA as it relates to the work that we do. So yes, documentation is key, and keeping up with that documentation is key as well. So we set a goal for you all to have all of your documentation in every week by Friday. It would be the best for you. And as you go along in your work, you will see why that is so important to stay on top of your documentation. Next slide. All right, training. So this is one of your first training / orientation, and training is extremely important for our program. It provides an opportunity for us to give you the knowledge, skills, and abilities. Many of you are younger coalitions, and so getting to know, what the SPIF is, getting to know what SAPS is, getting to know how to engage your community, how to do the work. that you all have graciously signed up to do through this program. And so training is very important. We provide face-to-face training, although the majority of the training will be online, simply because we are really excited about the fact that we're able to support communities across Kansas. And so we do understand that travel could be limited. The one thing takeaway from this slide is, as I mentioned, training is very important. We ask at a minimum that at least one person from your coalition attend all trainings. It's very difficult to make up trainings. It is very difficult to ensure that all of our grantees have all of the information that they need to be successful. So again, we ask that at least one person, if the whole coalition can come, that's even better. If your fiscal agent can come, that is the cherry on top. But we leave this slide by saying training is very important. The expectation is outlined on your scope of work, that the trainings that you're required to attend, our expectation is that you attend. Next slide. So again, we're talking about documentation, we're talking about strategies and logic models and quick checks and all of those things that right now you're saying, have no idea. But don't fear, we will be talking about this later on in the orientation. But we just want to stress the fact that we are a program that believes in fidelity. We believe in evidence-based practices or promising practices for those communities that have unique populations. But we want to make sure that we as the KPC are with you every step of the way, that we are reviewing your strategies, your logic models, your plans of what to do to make sure that we ensure that infidelity, to make sure that your practices are within the realm of what SAMHSA approves and what we approve. We in partnership with the KPC, DECA, Greenbush, and KU will work with you to ultimately approve all your strategies to set you up for success when you are working in your communities. Next slide. So we talked a little bit about the KCTC survey. As a participant of KPCCI, we ask that you start a relationship. Kitty talked a little bit about the sectors, but we want you to start a relationship, set a foundation with your school districts if you already have it, and really press upon them the importance of data, not only for reporting to SAMHSA, our federal partners and our individuals who fund us, but also because this data is also what you will be looking at in your community to identify the areas of need and to ensure that the strategies and practices that you execute meet the needs of your community based on the highest needs that you can reach. So with that, we really press upon all of our partners, and us included, that we create those relationships with the school district. Our goal is 60% or higher participation in the Kansas Communities That Care survey. And again, later on, if you have not heard about the student survey, you will hear more about it later on in this presentation. Next slide. So you will be sending forms to KDADS and other entities. Some of these forms will need to be signed. So what is an appropriate electronic signature? Well, we will be sending you forms that will be in PDF forms, that will be in Excel spreadsheet forms. And so those forms are allowed to be signed electronically based on the programs that you have. If it is within your budget and you don't already have it, I would definitely encourage you to look at investing in Adobe Pro, not only for the work that you do with us, but in general, There are other documents that are able to be signed electronically, saves you a lot of time with printing and scanning and things like that. So electronic signatures are appropriate and are acceptable. We do also accept handwritten signatures as well. I think the biggest takeaway is just ensuring that where there's a signature, that you please sign it before you send it to us in whichever way, shape, or form. Next slide. All right, so let's get into the good stuff. Payments. So when you applied for the planning KPCCI program, in the RFA, it indicated that this is a reimbursable program. So the biggest takeaway, if nothing else, as it relates to finances and as it relates to how you are getting your funding, is this is a reimbursable program. Once we have received your fully executed contract, we will send you a financial form that you will utilize. We'll talk a little bit about that in a minute. However, we are asking that by the 20th of every month for the previous month's expenses that you submit your financial report. Again, similar to documentation, getting behind on sending your monthly reports is not the best thing to do. It causes confusion with your accounting and also with our accounting, and we want to make sure that on both ends that our accountings match up and that you're receiving your payments in a timely manner. But for an example, this is July, the last day of July. So all of your July expenses that you paid out of your funds will be reimbursed in August for July expenses. You must have incurred those expenses, utilize your own funds, and then we will reimburse you in the following month. The months cannot be combined. We send you one financial form. That form can be utilized every month. But again, to the best of ability, staying on top of those monthly forms is wonderful and will help you a lot, because many times people think, oh goodness, I haven't sent in a financial report in like 3 months. And so then they try to combine 3 months. Well, we won't be able to accept that. So all financial forms have to be for the month in which the reimbursement is being requested. As I mentioned, each coalition will have their own personalized Excel spreadsheet form that will be sent to you when your contract is fully executed. Again, all expenses are reimbursed monthly. And if you have any changes, this is another thing where you can put a star by. If you have any changes to your fiscal agent, your bank account, your name of your coalition, anything that would in any way impact your payments getting where you want them to go, please contact your prevention consultant as soon as possible. Our payments are not distributed through KDADS. They're distributed through the Department of Administration. So they need that information to ensure that your reimbursements are going where you want them to go. Next slide. So here's an example. It's kind of small, but it just gives you an example. You will see this form when we send it out to you, but this is just an example of what your financial form will look like. It will indicate on the left-hand side all of the different levels, personnel, fringe, travel, all of those things that you sent in for your budget. All of them will be already pre-populated. Go back one. All of them will be pre-populated. This form also has built-in calculations in the form. So you will be able to enter your information every month, and it will calculate including your cumulative expenses and your final expenses. The take is please do not alter this form. Please do not send us a form of your own creation. You will be utilizing this form. One thing that is an update for anyone that has seen this form before is due to federal oversight, we at KDADS will also be documenting the day that we receive the form and that we've confirmed that we've received the form. If, for an example, you send in your August, you somehow got a little backed up a little bit. Again, let's try not to do that. But say you send your August in December for reimbursement. The date that is on the financial form should be the date that you sign it. So even though it's your August form, and maybe even the person who was supposed to sign it signed it in August, but oops, something happened and it didn't get to us until December, the date in which you send in the form is the date that should be on the form. Again, we have federal guidelines that require us to process financial forms in a timely manner, and it gives us a time clock. So that time clock starts the day that we receive your form. So signatures and dates on your form are very important. One last thing about this is we know for many individuals, this is a new process. KDAD's behavioral health consultants, Kitty and Alexis, and then myself are always available to assist you. So instead of scratching your head or trying to figure it out yourself, if you have any questions, please reach out to us. Next slide. And I'm passing it over to Kitty and Alexis.
For this slide, it shows the prevention consultants, Kitty and I's contact information and our assigned coalitions. So the planning grantees I'll be supporting are Quality of Life, Republic County, and Barber County.
Yes, and my contact information is over on the right-hand side and in the planning group. I'll be working with Miami County, Woodson County, and Haskell. Next slide. Yeah.
So this year, when requesting a budget reallocation, because over the course of the grant, the budget estimates you originally submitted may have changed, you will receive a new form to complete and submit to your assigned prevention consultant. At the top of the form will be your coalition name, the name of your agreement, and the date of the request. After that, there's a chart that will need to be filled. The first row just lists all the different budget line items. The next row will be the current budget amount for those line items. And then next, what you are wanting to be changed and the reasoning for why the change is needed. So for every budget line item that there is a change in the budget, it would need a reason for that. So for example, move 5,000 from contractual to supplies because contractual expenses were over budgeted, and the move will be used to cover an example of the supplies the money will be used to cover. And then the last column would be the new total of the line item with this new change in place. So please be sure to request a budget reallocation as soon as you're aware that one is needed, because there's no set time limit on how long this process can take. Next slide.
Well, just to piggyback off of that, again, I want to drive home the importance of, we do realize and recognize that it has been a few months since you applied and submitted your original budget. So we do understand that along the way things change. But one thing to just drill down that Alexis mentioned is this process, once utilized, takes time. And so as best as possible, try to be as accurate as possible with your budgets Try your best to not utilize the budget reallocation process on a regular basis. Try to really work with your team and with your fiscal agent and with all those individuals that are responsible for funding to get the best and most accurate budget possible. But again, we do understand that if changes need to be made, this is the form to use. But just know that when you submit a budget reallocation, that does extend the time frame of you receiving your reimbursement. Next slide.
This is my slide. I just wanted you to think about this because it comes up a lot. Just all of you here are serving in different roles with your coalition. So I'm asking you to think about who is the one person who signs. So this is the person who signs everything with KDADS, and there's only one. And so that person is the person who signed the contract with us, with KDADS. They have agreed to take the responsibility for all the contracting and the financial reports, and that is their signature that we want. So if you're in a different role within the coalition, I want you to think about meeting with that person. And actually, over the phone, it could happen. It doesn't have to be a formal meeting, but you kind of need to think about how you will communicate with that person. How will those expenses be paid? Because as Stephanie said, they're paid up front, and then KDADS will reimburse those. So that's a process that needs to be talked through. And then also, how will those receipts be turned in? How are they going to be collected and safekeeping? So I would encourage you to think about early each month. You as a coalition member or a community mobilizer would look through your last month's expenses and make sure that everything is paid up to date and seems to look correct. Then you would meet or double check in with your financial person because you come to the amount that is correct to be requested from KDADS for reimbursement. The financial person is the person who fills out the KDADS form. They sign it, they date it, and they submit it to KDADS. We would prefer it. It really can't process it unless it's in a PDF format. And then the last thing to think about on that is Alexis and I, and Stephanie, no telling how many thousands of emails, but this does actually help if you can think of it, not to get lost in the email buckets, to put your code as the subject line in your email to either Alexis or I. You can carbon copy to Stephanie, which would be fine. But if you could write your coalition name, the KPCCI planning grant, and then the month and year, that helps us to pick them up out of the emails and keep them moving in a timely manner. Next slide. And being a person who took this responsibility in some organizations, we all do, this is a heavy responsibility to carry on behalf of a coalition. So I just want you to remember to thank that person. They are responsible for collecting and keeping all those receipts forevermore, basically, and would be the person that would be called if KDADS had a problem, or other departments from the state of Kansas could come in and look at these records. So it's just nice to be nice to that person. So I think it's next slide now. Oh, okay. So I'm going to go through the dues, which are just a repeat of what we've already talked about. We're available. Ask us questions. It works out great if we can help you through some lumps instead of going back and forth with a form 17 times. That gets everybody confused. We talked about the signing and the dating of the financial report, and that you want to sign and date, and then turn that in as soon as possible, because we at KDADS are on a time clock. As far as processing, we only have a few days from the date that you sign it. We talked about turning in monthly financial reports. I talked a little bit about monitoring your budget, and you're doing that as a coalition on top of the fact that your financial person is also managing the KDAD's financial reports and the reimbursements. But you are also looking at your budget as you go along and planning your spending and trying to keep within those caps that you set for yourself. We do want you to spend your full award. It's not really good for anyone if you aren't able to spend it. It just goes back in the KDAD's bucket, and we would rather you be able to get the benefit from it. And then, as Alexis had said, if you see that you're going to need to move money from payroll to supplies or something, just start the conversation early, fill out that form. Let's get started. Let's figure out when and how that's going to happen. So.
And for the don'ts, as Stephanie previously mentioned, please keep the format of the forms as they're sent to you. Modified forms won't be able to be processed. Please don't change previous monthly amounts on your financial reports. If it's already been processed by KDADS, please keep it the same going forth. And then, as Stephanie mentioned earlier, please don't combine expenses for more than 1 month. Each month should have its own separate financial report.
Thank you. So this would conclude our portion of the presentation. Again, if you have any questions, we will be taking time at the end of the orientation to answer any questions, or you can throw them in the chat. And I'm going to leave you with this one thing as it relates to do plan to spend your full award. There are times when individuals think that, oh, well, if I don't spend $5,000, I'll get it next year. That doesn't happen. As Kitty said, it goes back into our KDAD's bucket. And we also want to show SAMHSA that the funds that they award the state to fund prevention, that we need those dollars. If we don't show that we need all of those dollars, then maybe we won't receive all of those dollars. So we obviously, as Kitty mentioned and did a very good job at talking about, ensuring that your accounting is accurate. And Alexis talked about the budget modifications, but at the end of the day, please make plans. Things happen and we understand it. And there are times when what we call money is left on the table, but continue to have conversations with your behavioral health consultant as it relates to spending your funds. If you're having some concerns or issues about that, or have some questions about that, please don't hesitate to ask. That is the big do. Please ask questions. So now we are going to turn it over to Decca. Thank you for allowing us to speak with you from the KDAD's perspective.
Awesome. Thanks, Stephanie. A lot of great information, very easy to understand, and just really want to reiterate that we are all here to support you, everybody on this team and the KPC team. So reach out to any of us and we will, if we don't have the answer, we will direct you to the person who does. So we're your biggest cheerleaders. We want to see you be successful, and we are all here for you. The DECA team is, most of us are on today. Ariel Kelly is on vacation, is not here, but I believe that everybody has met their community support person already. Chadley, Shayla, Julie, Michelle are all on here, and I think that we've all met. My name's Deanne Armstrong. I've been around a few years, so I think I have met most everybody. Also, I just rolled into the program manager role, and am happy to be here, and I'll be seeing your smiling faces at the quarterly training. So looking forward to seeing you at least on a quarterly basis. To discuss this wonderful flower or pinwheel or whatever you want to call it, And I really believe most of you probably are very familiar with this. We have a lot of grantees for the planning grantee year that have been introductory grants already. Some of you have already even attended the 4-day SAPS training where you were really dug deep into learning about this strategic prevention framework process that we call the SPIF. This is an evidence-based model. It was created by SAMHSA. What we are told by evidence is that communities that use this process are more likely to see the positive outcomes that they are aiming for. So we believe in the SPIF. We talk, eat, sleep the SPIF. As you heard from the KDADS folks, they use this process also for the state plan. So you will be engulfed in this, and you'll all be learning more about it, and we'll be supporting you and helping you to implement it throughout this year. This process is designed to help communities build prevention capacity, as well as infrastructure necessary to build that strong foundation of a coalition that can be around for the long haul. To support and your planning efforts, your implementation of those evidence-based strategies, to evaluate and sustain those effective prevention policy practices and programs that you implement, and continue to build that sustainability of the capacity of your coalition, of the foundation, as well as your implementation strategies. So we are excited to dive into this each quarter with you when we meet. Next slide, please, Chad. So just a little bit about the SPIF. It is a very natural process. We use it every day without even thinking about it. When we plan what we're going to wear in the morning, when we plan our meals, if you plan a vacation or a trip, we go through that process very quickly and easily. And so looking back at that, you assess what the weather's going to be like, where you're going before you decide what you're going to wear. You look in your closet to see what do you have available, what's the capacity of your wardrobe for the day, what's clean, what's dirty, you know, what fits anymore, whether you have been on vacation and gained a few pounds or not. So we do a lot of assessing and around our, yeah, Chad, I know that work. Was it good? Was it comfortable? Did people comment that, you know, they liked what you had on? You might, you know, do a little evaluation to decide whether that's something you want to adjust and not wear again, or do wear again, or wear it with different pants, you know. We do these things all the time very easily without even thinking about it. It is really a natural process, and we're going to try to make it as painless as possible as you go through this process with your communities. And that's a lot of it. It takes the community, and part of your jobs as community mobilizers is how do you guide your communities through the process, not just one person. So it is an evidence-based process, though. It's like a business plan for your coalition's prevention efforts. You'll learn about the SPIF and how to apply it throughout the strategic planning year. And we look forward to diving in with that with you. It is data-driven. That's why we're going to talk about data here in a minute, the importance of data, because you don't want to just bring people together and have a conversation around everybody's opinions. Qualitative data is important. You do want the voices in the room to speak, but you want it to back up the quantitative data that you have also. So you're going to hear us talk a lot about data, and this is a data-driven process. You will identify evidence-based strategies because we want you to work smarter and not harder. We want you to be efficient so that your strategies are really making an impact and making a difference, and not a waste of your time, money, or efforts, and especially not causing harm. So you'll hear us talk about those evidence-based strategies. Yeah, we're going to be diving into it. And so looking forward to it. And I'm going to, I believe, pass it on Oh, no, this is still me. We talked about this already, though. Assessment, capacity planning, implementation, evaluation. It's all part of that SPIF process. You can go to the next slide. As well as sustainability. And sustainability, you're going to hear us, it starts at the beginning. Everything that you do, you're going to be thinking about, how do I sustain my data? How do I sustain my assessment process? Capacity building is really a lot about sustaining. It's like a house. My husband's a contractor, and there's a lot of foundational work that happens before a building can go up. And it looks like there's not being anything done. It can get discouraging, but that foundation is very, very important. And when you build the capacity, a strong capacity of your coalition, that's going to also be a sustainability as you build upon it, so that it is long lasting and can really see those positive outcomes happen. And if you just take a quick glimpse back at thinking about tobacco prevention, if you look back 20, 25 years, if you were around, it looked very much different in our environment. You go into a restaurant, and it was very common to see a lot of smoking happening at tables, and smoke in the air, on airports, in meetings. And that wouldn't even be heard of today. That would be so unnormal and unfamiliar to any of us. That prevention was successful, but it took a lot of years, and it took strong sustainability for communities and for coalitions, a lot of policies and programs and practices to happen in order for those positive outcomes. So we're in it for the long haul. So sustainability is important. And of course, we always want to be culturally inclusive in all of those phases of the SPIF. So that will also be encompassed in every step along the way.
Good morning, everyone. My name is Jeremy Johnson. I am one of the program evaluators at Greenbush, along with my partner in data crime, Elisa Nurbis, who will be working with you over the course of the next several years to do what Deanne was describing with data collection. So the ways that we will do that, and kind of our goal for today is not to get into the weeds. There is a separate webinar that we will do with you all next month, I believe, regarding data collection and evaluation. This is just meant to be an introduction, a broad overview of what it is that Elisa and I can help you out with. So in terms of reviewing, analyzing, and collecting data, there are really three main sources that we're going to be pulling from. The most important of which many of you have probably heard of, and I've actually worked with a handful of you on regarding, is the Kansas Communities That Care student survey that Stephanie had mentioned earlier. So for anyone who is not familiar, the KCTC survey is administered to 6th, 8th, 10th, and 12th graders throughout the state. Any school district that is interested in participating is able to administer it to their students free of charge. It is covered through KDADS. We contract with them and administer it to any school that wants to participate. And then the data collected through that, which measures a whole bunch of different things. It's about a half-hour survey that looks at a bunch of different student attitudes, behaviors, feelings about community, family, peers, and the school environment, as well as questions about depression and suicide, substance use, those kinds of things that will be of significant value to any coalition doing prevention work, which you all are. And so the data then is utilized especially as you'll work with your DECA community sports specialist, but also with Elise and I to look through the data that you have available to see what that data is telling you, and then looking at ways to utilize it moving forward as you begin your prevention work. The second data source is the Kansas Young Adults Survey, which is fairly similar to the KCTC. It is structured similarly, but it is focused on 18 to 25-year-olds and has its main focus is on substance use and risky behavior. Um, that that survey, drawing from the demographic that it does, is significantly smaller because it's not sent to kids in schools. It is, sent out and shared with young adults basically around the state and asking about their behaviors, thoughts, feelings on a whole host of issues. And then finally, and perhaps most broadly, is the Kansas Behavioral Health Indicators Dashboard, which looks at a whole host of measures across a wide variety of topics ranging from depression, suicide, to income and poverty, to health indicators that can be used as sort of a broad snapshot for your county and the area that you're serving, but ultimately is going to be far less granular than the KCTC, which is really the gold standard as far as the work that you all will be doing as part of your KPCCI grant. Next slide, please. All right, so as I mentioned, the KCTC is really the information source that we're going to be relying most heavily on. And so the survey's been around for 30 years now. We've been administering it on behalf of the state since 1995. And so as part of that kind of 30 years celebration, we produced a new video this year interviewing a bunch of different people from coalitions and schools and communities talking about the value that the survey that the data that's collected in it provides to them in the work that they're doing, both in schools, in communities, and in prevention work. So, Chad, if you're able to play the video, and then we'll see if everyone can hear it.
The Kansas Communities That Care survey is conducted annually and anonymously with 6th, 8th, 10th, and 12th graders. The survey provides valuable insights on the health risk behaviors and opinions of students in your community. In this video, we want you to hear firsthand how schools benefit from this data.
We're building their future. We need to make sure that we are utilizing all opportunities we can to understand what they are going through and where they are at.
It's been super helpful to hear what the students have to say and hear their voices using that data, because sometimes it's hard to get that from them, and then just being able to write our grants and get those resources that we need for the community.
It allows you to quantify some qualitative information. So we have some feelings about what's happening in our district, but the CTC data allows us to quantify that.
You don't know what the kids in your community are going through until you have that survey, because a 14-year-old is not just going to come up to you and tell you that they're suicidal. But you get that survey back and you find out that 1 in 5 kids in your community struggle with depression. That's just information you need to know. So you need to ensure that they have a bright and happy and lasting future, and you can't ensure that until you know what they're going through.
There's plenty of good data that comes out of this that you can kind of hang your hat on and say, this is where we're being successful. And on the other side, it's, hey, this is where we need some work. We need some education for our kids. We need some education for our community. And what can we do about it?
And the survey addresses not just the substance abuse piece, but the bullying and the depression, and really a lot of problem behaviors that I think are critical to us and make sure we're serving kids in a way that they get the most out of their education. I mean, we know what student behaviors we see, but them reporting to us their beliefs and their thoughts and their behaviors, it's kind of a critical piece. And we're only getting that really through the Kansas Communities That Care survey.
The Kansas Communities That Care survey is conducted annually.
So, hopefully that will give you kind of a broad idea of the value that the KCTC provides. That the goal of it really is to provide insight that would otherwise be unavailable to people doing this work, right? That as Isabel Blackwood in
The Kansas
is mentioned in the video, that most kids are not sharing the kinds of things that are described within it on a day-to-day basis with the adults in their lives, right? That it really is a window into a world that would otherwise be inaccessible, and thus provides a jumping off point then for doing this work in a way that is going to be meaningful and impactful. So among the data collected through the survey, one of the main ones, and one of the ones that you're going to be looking at as you're getting into prevention work specifically, is on substance use. And so there are a handful of questions in the survey that ask things about students' both perception of substance use, but also their behavior within substance use. And so one of the main kind of trend lines that we look at is the question about what we call 30-day use. And so the question is, within the last 30 days, have you utilized, and then there's a list of substances. And that gives us then a pretty on-the-ground, up-to-date picture of what are students doing, what are the kinds of behaviors that they're engaging in, what are the substances that they're using, that then can allow us an idea of where we need to begin with our prevention work to begin to trend those things in a more positive direction. So the graph that you see on this slide collects the 5 most common of the substances over the last 3 years. Thankfully, you'll see that all of them, except for prescription drug use, are trending in the right direction. They are decreasing, which is great news. Again, thanks to the work of folks that have been working in prevention for a very long time to try to get that to be the case, as Deanne had mentioned. As kind of has been typical for several years now, alcohol tends to be the highest, closely followed by vaping, binge drinking related to alcohol also up there, with marijuana kind of in a further third, and then everything else much lower down. You may notice cigarettes are not one of the things on this list. When we started administering the survey back in 1995, somewhere around 35% of students said that they used cigarettes. Today, that number is less than 1%. Significant strides made in that area. However, that has been supplanted, thankfully not to the full extent that it was 30 years ago, but to some extent by vaping, right? That kids are not utilizing cigarettes now. They are utilizing e-cigarettes to do both nicotine, but also, frankly, marijuana and THC. So those are kind of the areas that we've seen over the last handful of years as being the main ones of concern. And as you begin digging into your data, as you begin your planning year and figuring out what are the problems that you're going to try to address, this data will be able to point you in the right direction, right? Because no two communities are going to be exactly the same. You're going to need to look in and figure out what are the problems that are going on where we are, so that you're not taking a one-size-fits-all approach, right? That you don't have the, oh, well, we heard this community used this program or had this speaker come, we want to replicate that because they were successful with it, right? You want to actually know what's going on in your neck of the woods before you decide on a solution to the problem. Next slide, please. So we're talking a lot about data, and we're going to be talking a lot more about it in the future. So you might get tired of hearing this, but in terms of why it is so important, what the value, right? What value does this data provide? So through every step of the process, it's going to give you feedback on what it is that's going on and inform your process as you're getting into prevention work through every step of that. So starting out in with the assessment part, as you're kind of planning and setting up, data, again, through the KCTC, will help prioritize, right? It helps you determine what are the things that we need to be focusing on. If fewer kids say that they are utilizing certain substances, it doesn't make sense to focus on those, right? We want to focus on the areas that there's actually need to be addressed. And then a step beyond that, what are the risk factors involved with those substances that need to be addressed as well? Because it's not simply it can be easy to see the substance use as the main concern, but ultimately substance use is driven by something else, right? It is a symptom of another issue needing addressed. And so those risk factors are going to be important to look at, to drill down and figure out what are the issues really needing addressed here as we're trying to drive down substance use. And then once you have determined your direction and your priorities and you get into the implementation phase, you've chosen the strategies that you're going to utilize and the programs you're going to use data then to determine, is what we're doing being effective? Is it having the impact that we set out to have when we selected these strategies or programs, right? You're going to have data both from KCTC, but also if you're administering feedback surveys or pre and post surveys to determine, are the things that we're doing having an effect? If not, why might that be? What are the barriers involved? What is it that's keeping us from being effective in achieving the results that we set out to? And what do we need to do to change that, right? So it's not simply we're going to bang our head against the wall for 3 years utilizing strategies that are not having an effect. We're going to evaluate as we're going through the process, and if we need to pivot, if we need to switch strategies, if we need to change our approach, data will help inform that process and figuring out what we need to do. And then finally, at the end of it all, using evaluation to determine, were we successful in reaching the goals that we set out to achieve? Did we hit what the targets that we said we were going to? Were we, again, effective in utilizing the money that KDAD's provided to us and met the objectives that we had stated at the beginning? Next slide. All right, so this map gives you kind of an idea of KCTC participation for this last year. So the survey is administered from September 1st until January 31st every year. As I mentioned, any school district that is interested in participating is able to. In recent years, and I think a handful of you know this as I've worked with you on this, I should also mention as an aside, one of the many, many hats I wear at Greenbush is actually a KCTC administrator. I'm one of a couple of people that help to administer the survey every year. And so I have some additional insight into the workings of that. And as I mentioned, have worked with a handful of people on this call to work on increasing participation in their parts of the state. So some brief history. Back in 2017, the state legislature changed some of the rules around student surveys and switched from an opt-out process where parents would say, we do not want my student to participate, to an opt-in process where every student that takes the survey is required to have parental consent explicitly stating that their child can take the survey. The year after that happened, participation nosedived. We made some strides in improving participation after schools got comfortable and had an understanding of the rules. And then in 2022, the rules changed again when the legislature introduced a 4-month consent window, which means that between the time that parents give consent for their child to take the survey and them taking the survey, it cannot be longer than 4 months. And again, when that happened, everyone freaked out and participation nosedived yet again. And that being 3 years ago, we have since then seen basically the lowest rates of participation in KCTC since we've administered the survey in the last 30 years. We are working on strategies to improve those numbers. A lot of that work I've been kind of conducting in reaching out to both coalitions, but also school districts and communities to try to engage in conversation, which is one of the things we're going to talk about here in a second, about why this is important, the value that it provides, and the things that it can be utilized for once that data is collected. So that's one of the reasons that you see so much white space on this map, that we have a lot of work to do in terms of regaining our participation numbers, but that is one of the things that Elisa and I are happy to work with you on as you're planning for your implementation year. Next slide. Okay, so as far as increasing participation then, when it comes to deciding whether or not a school is going to participate in the survey, the superintendent is the decision maker in this process, right? So whether or not they are participating, that's going to be the person that you're going to need to talk to if districts within your community do not take the survey, or if they do already take it and participation numbers are low. Having conversations how to improve that are going to have to end at least with the superintendent and school administrators. So in terms of ways of engaging in those conversations, right, because ultimately the goal is to convince schools this is a valuable thing, we want you to participate, we benefit, but also you as school administrators and teachers also benefit, as does the broader community, for all the reasons that many of us know, because we're in prevention work. That's what draws us here. And so one of the main and honestly most significant ways that you can do this is invite school representatives, especially those decision makers, to be part of your coalition, right? Clint Corby, who's superintendent of Lehigh Hillsborough, that spoke in the video that we just watched, is currently the vice chair of their coalition and is one of the strongest advocates for the survey, and their participation rates are through the roof. Those are not unrelated facts, right? Involving school personnel, particularly decision makers, as part of your work is going to make those conversations about why the survey is valuable, why we should be utilizing it, much easier to have than if you're an outsider coming in that frankly is often seen as a threat, right? In smaller communities, we tend not to want to have conversations about a lot of this stuff, right? The conversation often can go in the direction of, well, we don't have that problem here, or, oh, that's not something we need to be worried about, right? Our kids wouldn't do that, is often the tenor, right? Built into that is frankly a lot of fear and discomfort, right, around having conversations around these kinds of things, which can be difficult. And so finding ways to make that conversation go easier, to show that you're not a threat, not being combative, really goes a long way, that we're a partner. We're working toward the same goals. We want to improve student outcomes. We want to improve testing scores and graduation, both of which have a direct correlation to this work, right? And so finding ways to include those people as part of the work and include them in the rooms that you all are in will make that work go easier. That it makes you less of a stranger, right? That you're a known person with shared values that is not here to make life difficult for the schools, but to improve life for the schools, right? And particularly for kids. And so one of the ways to begin doing that is setting up a meeting, right? Having conversations with people, reaching out. I will say, do not have the first meeting be an ask. Do not go in for the first time and say, hey, we want you to take the survey, right? Part of relationship building is going to be making people familiar with who you are, the work that you're doing, the goals and values that you have, before you come in and say, hey, I want you to do this thing that maybe they thought about, maybe they haven't, maybe they have negative connotations, right? That they're afraid to jump into. And so building that relationship before coming in with a list of demands is going to make that far easier, right? That it's going to be more comfortable, that if there are hangups, if there are concerns, they can be addressed rather than simply dismissed out of hand along with you and the work that you're trying to do. And then lastly, utilizing the video, right? Part of what we wanted to achieve in creating the video was having people, particularly school personnel, 3 of them were included in those voices that you just heard, speaking to the value, right? That again, this is not just some niche concern that we over here in prevention have, that this has long-reaching implications and consequences, that it can be a powerful tool in addressing concerns that are widely shared for people working with kids, right? And so utilizing those tools to share that message, whether through social media, but also through personal interaction, right? Because again, relationship building and particularly face-to-face stuff is going to be the most powerful and effective strategy in terms of bringing people in schools into the fold and beginning to change minds if people are hesitant or unwilling or uncertain about utilizing the survey. I think that is the last slide that we have. Elisa, I don't know if you had anything to add to all of what I just threw out there. But that's all
You
of what
did great. Yeah, we will be reaching out to all of you to help you understand what the data says. So that sort of thing, you will be getting a link from us about one of those sources of data that will be discussed later on in this presentation. But we are friendly people. Please, we love talking about data. We love supporting you all, so please feel free to reach out, but we will definitely be intentional about reaching out to you to set up time to talk numbers and how it's important and what's behind those numbers, right? Their youth, their youth experiences and beliefs and feelings. So excited to meet with all of you, and yes, that's all I got to say. Thanks, Jeremy.
Hello, everyone. I guess it's our turn. Hi, everyone. Thank you for joining today's orientation. My name is Leila, and I'm working with KU alongside Jerry and Tinian as one of the KPC partner. I would like to point out, since we have a very extensive and detailed CCB documentation training designed specifically for your cohort next week, August 5th. We won't go into much details today, like probably other partners. The goal is just to give you a high-level overview of our role and the tools you will need to use moving forward. Next slide, please. As I mentioned, KUCCHD is one of the KPC evaluation partners, mostly supporting data collection, analysis, and reporting through tools workstation, which is short for WST, and the community checkbox evaluation system, which is short for CCB. And these are your go-to platform for tracking and reporting all your activities. So please make yourself familiar with these acronyms because you will be using those a lot moving you forward. Next slide, please. Here is a screenshot of workstation. Technically, this is a communication hub for the KPK grantees, allowing all to have access to the source documents or all reports or all deliverables. So you see links labeled with the name of your coalition on the left side of a screenshot. We have granted your access using the email you already provided us as your primary contact, but some of you have not confirmed or shared the email yet, so please make sure to do so after this meeting, kind of allowing us just to go ahead and make sure you all have access to both workstation and CCB. Next slide, please. And here is a screenshot of the main page of CCB. Like I said, CCB is an online monitoring tool that helps user just to record, measure, and report all their efforts or activities, which helping them actually and us to understand what is going on and understand how they are doing in accomplishing or achieving their goals or their preventive programs. Top of the page, you can see the Interdata tab. If you hit this, it takes you to the accomplishment form, which is the most important documents you are expecting to complete weekly basis moving forward. Again, we have granted your access to CCB, like the workstation, using the email you provided us as primary contact. So those have not yet, please do so after this meeting. Next slide, please. And here is a screenshot of the accomplishment. Like I said, when you go to the CCB main page or landing page, it takes you, if you hit the new data, it takes you to this accomplishment form. Like I said, we need, you need like to fill it out each time you achieve a goal or take a step toward towards your goal, which are mostly in the first year of your grant. Mostly all the activities center around the capacity building. So whenever you kind of get it done, any sort of activity, any meaningful, tangible activity, just to achieve your goals, you need to go ahead and fill out or complete this form. Next slide, please. Here is a figure just to give you a general sense of what the accomplishment form consists of. Technically designed just to capture all details of your activity, categorized in 5 domains and subdomains. Like I mentioned earlier, we walk you through all these fields, domains and subdomains during our CCB training next week. Next slide, please. Here is the visual of monthly CCB workflow. It starts, as you can see, it starts with your part, which is weekly documentation, and we can emphasize how important it is, because your part helping us just to go ahead and proceed with the process. So it always starts with your part, which is weekly documentation, and continue with our part or our contribution, which is like, going over that, reviewing and reporting back to you and KDADs or the other partners, your monthly performance or any other sort of feedback. So next, I guess you need to click. Yeah. This slide I tried just to, simply break down of your monthly tasks or deliverables. We expect you guys just to do. Just please remember to documents on each Friday. It's an ongoing process. You never stop documenting, as you never stop, doing any sort of activities related to your plan, goals, or capacity building, specifically in the first year. And then review the monthly report. We get back to you on 15th of each month, and completing quick check survey by the 25th, and attending the office hour if you need any further, like the guidance, training, whatever you might have, in the first Thursday of each month. So we will be there just to provide you with any additional training or guidance if you need it. That's all we have for now, but looking forward to see you guys next week, 5th, and we're gonna walk you guys through all the CCB documentation process in detail. So yeah, that's all. I guess I will hand it over to Diane, or yeah.
Thanks, Layla. All right, so we want to get you started on this process and this fun journey throughout the year. And so we're going to start off with assessing, because we believe you do already have some capacity. You have coalitions, and we're going to start off with, as Jeremy talked about, you need to find out where we are right now before we know how to build on it, before we know where our strengths are and where our weaknesses are. So we're going to work on some assessment. Next slide, please. And can you go ahead and click and populate that? Thank you. All right, so in order to assess, Jeremy talked about a lot about needs assessment to identify what is the problem, and then you're going to identify how to prioritize that problem that you want to address, and what are the influencing factors that are really driving that problem. But taking a step back before we even do that, we need to make sure we have the capacity and everybody at the table, that we have that firm foundation like I talked about when you're building a structure. We want to make sure the foundation is solid and is in it for the long haul. And so we're going to look at some capacity building first. So we're looking at two different things with capacity. We have the capacity of our coalition, the structure of the coalition, the purpose of our coalition, how it runs, the process of the coalition, the communication internally and externally. Do we have a vision and a mission statement? And I know a lot of you going through the introductory grant year, you worked on all of those things, but it never stops. we always have to continue to work on maintaining and continuing to build, making sure that we have good rapport, relationships like Jeremy talked about are all really important things, and that's all a part of capacity, as well as continuing to not only workforce development, educating ourselves, being up to date on what the newest information is, but also our coalition and our community. We want to make sure our community is ready to embrace and support our efforts. So with capacity, we're going to have you do two different assessments, a way to gather the data that you need so that you can identify where you are now so that you know what effective action steps you want to take in order to increase that capacity. So the first one we're going to talk about is our Coalition Capacity Online Survey. If you want to click to the next slide. This is a survey that is done every year through your KPCCI grant, to be able to look back each year then and see where the progress has been, so that you can change courses if you need to, you can adapt your action plans. Maybe you've succeeded in capacity in one area and you want to shift gears the next year. So we're going to have you take your coalition, everybody that's on your roster, take this coalition capacity survey, which we have tweaked a bit this year. So hopefully we have updated it so it's taken out some of the things that maybe were what didn't make sense, maybe was kind of outdated, but this is what this actual survey looks like. I'm going to go through and show you a timeline here in just a minute, but this survey comes from Greenbush. They will send out an email with a link that you're going to provide to all of the members on your roster, and this is what it looks like when they click on it and take that survey. Next slide, please. This survey is going to measure a number of different things. They're going to find out if your coalition members that take the survey about the vision and mission and goals of your coalition, about the projects, all these different dimensions that you see on the slide here that you don't need me to read to you. There's going to be questions that gather information about all of those different dimensions. Next slide, please. And this is the process. So Greenbush is going to send out that link, like I told you, and they're going to send it today. So you can all expect to receive it in an email. If in a day or two you don't receive it, please reach out to any of us and say, hey, I didn't get my link. It's going to look like the one on the screen there. It's going to be a Survey Monkey, but it should have your county's name on it. There's only been once or twice, but it has happened. We're human. If it doesn't have your county's name and it has somebody else, other county's name on it, please let them know right away, because there's a lot of you, and sometimes mistakes or errors do happen. But so make sure that it has your county, and then by August 5th, you can do it right away, but at least by August 5th, we want you to send that out to your coalition members. You might want to put, an email together that explains a little bit about what the purpose of it is, what you're going to be doing with the data that's collected, that it's confidential data, there's no names on it, and just helping them to make sure that they're not having any apprehension about taking the survey. And just get that sent out, encouraging them to please participate. You do want to get as many participants as possible. Greenbush then, in a week from the August 5th, on the August 12th date, they're going to send you another email letting you know how many have participated. So you know whether you need to do another plea, another big push, letting them know, hey, only half of our people have participated. We really would like to shoot for at least 80% or whatever your goal is, however you want to push it out. You know your own people best. And so we encourage you to get as many as possible, though. So you'll resend that link, and then after that, the survey will close on the 19th. So know that you have until the 19th, but then the survey will close because Greenbush needs to gather all of that data, put it together in a report that they will give back out to you. As Elisa said in the chat there, that they can set up a time to help you to understand that data. The reports are going to be put in your folders on the workstation. When we meet on August 7th for your first SPIF content training, we're going to go over those reports also and help you to know what to expect, what to look for when you get those reports, and what to do with them. So all of that is going to help you to identify what actions you want and need to take moving forward so that you can add that to your action plan on building capacity. And this will be something that you could form a work group to look at and to help move this forward. But we just really want to emphasize it's not just a one person's job. It's not the community mobilizer or the chair to take this all on. We want you to take this data back to your participants, your coalition members, and help them to see how that report came out and get their input on their ideas on the gaps and the strengths, what you need to continue with the strong areas and what you might need to do to increase some capacity in some of those weak areas. Really want their input. This is what the reports look like. On that first page, it will tell you how many people participated. And it will also tell you the different sectors represented, no names, but it will at least tell you like how many were from law enforcement or from schools. So you also know who participated. And you'll be able to look back at that each year and do some comparison. Next slide. This is inside what the report looks like. If you click once, Chad, I think, there we go. So on this one, this is an example of a coalition that this is their second year maybe of taking it, or they've taken it before. And so there's two columns that say columns 3 and 4. There's one for the year that they took it in, which is circled in red. That's what you're really going to pay attention to for this year's data. And as you can see on this example, that top one was the lowest. It had the lowest number of the percentage that said that they strongly or kind of strongly agreed with this and it's the community members and organizations are aware of our coalition's vision, mission, and goals. So that was a lower area. That would be conversation around, is that important that we need to strive to making that change? If you agree that's a priority, then you would have conversation around what are some action steps that we could take. They don't need to be huge. It could be, let's start putting all of our vision, mission, and goals at the top of our agendas every month at our coalition meeting. Maybe let's go back and review and revisit at least quarterly what those are to bring it to everyone's attention and see where we are. They can be small things, but that's what this data is for. Also, like in this example, where this was a coalition who's taken this survey previous years, you can look really easily and see, oh, but it's higher than it was last year. And so good job on us. Whatever we did, it worked, but we want to continue doing that and maybe do a little bit more. So it also will help with that. All right. This also is a snapshot of a page, a work page, and that is called the SPIF Guide. And this is just a helpful, hopefully, tool, like a workbook that we have created that is in your folders in the workstation. It will have information to help guide you through the whole SPIF process with some work pages like this that allows you to document your work as you go throughout the year, which is really helpful if you happen to have staff turnover. Then you have the information there to give to the next person, to share with your coalition. It's really also helpful if you look back, 3 years from now, a lot's happened. You want to look back at that data and how you got there and what was happening in the planning year. So we really encourage you, but it's not required. but we really encourage you to use this as much as possible because I think it was very beneficial to you and helpful to you. It's not for us, it's for you. It also will have, like in this place here, you could put your highs and your lows. It helps you analyze that data report. And then there's some questions that help to kind of ask the group that you're working with also about helping to prioritize some of those areas. So I encourage you to find that SPIF guide and take a look at it, get familiar with it. We're going to be talking about it in those quarterly trainings and get familiar with it more. All right, so that was quick, and I just want to do a quick question, a time for questions. Anybody have any questions on, especially the important thing is you're going to receive those links for that coalition capacity report. Any questions on that? All right, the other thing that I didn't really highlight, and we're going to get into this more, is that second type of assessment for capacity is the community readiness interviews. Some of you have already participated in doing that readiness assessment with your communities. Those who haven't, we will do a whole separate training on that, but those are conducting at least 10 interviews with different community members that you identify to be able to gauge the readiness with leadership, the understanding of prevention, the understanding of the problem areas in your community, their opinions and thoughts, and if they are ready to support your efforts. So more to come on that. All right, now you can do. So this is just a quick review reminder of the grant requirements that we've all been hitting on and talking about. Review your monthly progress reports from KU that Layla talked about. Those are going to be put into your folders on the workstation. An email will come out to remind you that they've been posted and completed. They're done by the 15th of each month, and they want you to review those, look and see if there's any feedback that needs to be addressed. And there's also at the bottom of the feedback page on those reports will be a link. And that link is to quick check questions that are very short and brief. And it's a time for you to share what successes you've had. Are you having any barriers? Are there any contextual changes in your community that we should know about? They're very quick, very easy. The report from that goes back to all of your support members, so we know if there's something that we can help you with. We're always also an email away, but we love seeing your successes. And if you have a barrier and put that down there, we also know that we will address it and we'll help you with it. Attend required trainings, at least, as Stephanie said, at least one person. We also really recommend that it's the right person. Sometimes, we've had in the past where somebody sent somebody from their coalition, but they didn't take that information back and share it. And so it really didn't benefit their coalition. So it is important to also to have some consistency, sending the people that are going to use this information, take the information back to the coalition and benefit from it. Those monthly financial reports to KDADS, the 20th of each month. Weekly community checkbox entries that Stephanie talked about and Layla shared about, and you're going to get training on the 5th. And then those deliverable documents that aren't going to be due until closer to the end of the grant, but we're going to show you what those look like. There's a logic model and there's action plan. There's mainly just 2 documents, but they include a lot, and we're going to share those with you right now. If you want to go to the next slide. This is a copy of the quick check questions. So as you can see, very short, very easy, very simple. Next slide. This is a snapshot of what the logic model looks like. These are also in the SPIF guide that I mentioned that I want you to go find in your folder on the workstation. At the back, you will find a copy of this. Well, you're going to get trained how to do it also. No worries now, just want you to see it. This is the action plans, and this is where there's different sections. So the top section there is if your coalition or your community that you're serving has less than 60% participation in the Kansas Communities That Care Student Survey. This is where you need to start brainstorming. What can you do to build those relationships, build that rapport? What action steps can you take that Jeremy talked about in order to partner and increase that participation? Because that data is benefit for everybody. And then the next section is about those capacity building steps. So that data that you've gathered from the Coalition Capacity Survey and the Community Readiness Assessments, that data is going to be used to identify what actions you need to take to build capacity. You're going to get more training on that. Next slide. And then much later down the road, a few months, you're going to be identifying, after you've done that needs assessment, what is the problem area that is prioritized? What are those influencing factors? And what are those evidence-based strategies that you're going to choose and that you're going to implement? And after you put those in the logic model and you get that business plan, that logic model completed, these are going to be where the action steps go on who's going to do what when in order to accomplish and implement those strategies successfully. And this is just a quick glance at this first quarter's trainings. None of this should be a surprise to you. All of the green there are required trainings for planning grantees. Also, the orange is that SAPS training, which is the Strategic Prevention Framework Application for Prevention Success Training. It's a mouthful. That's where you're going to spend 4 days with these wonderful people learning the whole SPIF process and having a lot of fun. I love SAPS, so I'm a big supporter of SAPS. So anyway, this is your training schedule. And you should hopefully have all of that on your calendars. Please pass it on to others that you would like to have join any of those trainings. They, as Stephanie said, if everybody in the coalition wanted to join us, wonderful, bring them along. But you'll have to provide them with the information that they need.
As you go along, I hope that you see the excitement and the momentum that we have about prevention in Kansas, about our program, about you being a part of our family. And so we look forward to working with you. Just a couple things that I've been thinking about while we've been going along, as it relates to the financial report. Please keep in mind that if you have a month where no money was spent, you will be required to send in a zeroed financial report for that month. That assists us and also assists you with timekeeping and accounting purposes. So keep that in mind. For many of you, at a minimum, you may have personnel and fringe being sent in. But just keep in mind that even if it is a month where no money is being requested to be reimbursed, please send your behavioral health consultant a zeroed out financial report. And then the second thing I wanted to talk to you about is the fact that now that you are part of our family, I'm not sure if you know, but there is a step after planning, and that is implementation. And you guess what? You don't have to apply for it. All you have to do is successfully complete your planning year and do the work that we all know that you are ready and anxious to start doing. And you will be with us for years to come, funding provided to support you in your work in the communities. So I'm going to walk away with this meeting, saying, I want to thank the KPC partners when we don't get questions, I can only assume two things, which I don't like to assume. Either we just did a banging job of orienting all of you, or you all are a bit shy. But either way, as we've all said, questions, questions, questions. There may be some things along the way that you think about that you didn't ask. When you bring this information back to your coalition members, they may say, well, why didn't you ask this? Or what about this? So even though we may not have answered any questions now, but definitely make sure that you are open to ask any questions that you have. We are here to serve you. So I will just say, yeah, Kitty said overwhelmed. Yeah, but like we said before, we don't bite. We're all good. We're all regular people who are just moving the charge of prevention in Kansas. So again, on behalf of KDADS, on behalf of myself, the Prevention Program Manager, and the KPC, we thank you so much for taking the time to meet with us and attend this orientation.